We've heard of this word called testosterone. Now, you might not be exactly sure what testosterone is, but in a nutshell, it's a hormone that's secreted primarily by the testicles in men and to a lesser extent the ovaries of a woman. It's a steroid hormone from the androgen group and is found in all humans and in some mammals too. Generally speaking, the adult male, his levels of testosterone are about 7 to 8 times as great as an adult female. In a man, testosterone plays a huge role in the development of the male reproductive tissue, such as the testes and prostate. It's also known to promote secondary characteristics such as increased muscle, bone mass, and body hair. In addition, testosterone is essential for health and the well-being, as well as to prevent a few diseases like osteoporosis. Testosterone is also responsible for a man's sex drive. Testosterone assists the testes in producing sperm and also helps keep a man's sex drive energetic and healthy. Now, if your levels of testosterone in the body are low, men can experience a decreased sex drive, and a decrease in sperm count, or even erectile dysfunction. Now, not all sexual troubles are due to lack of testosterone. For example, circulation problems can be responsible for erectile dysfunction as testosterone deficiency. Now, your physician will be able to better inform you if you suffer from a condition like this. Now, what about low testosterone? How low is too low? Now, for each year over the age 30 in men, the level of testosterone starts to slowly decrease at about 1% annually. According to the American Diabetes Association, over 13 million men have low testosterone levels. Now, this is a quantifiable number that you can get from your doctor just by doing a simple blood test. The bottom of a man's normal total testosterone range is 300 nanograms per deciliter. The upper limit is about 1,000. Now, these numbers can be loosely defined, just it depends on the lab's interpretation of the test, but just know roughly between 300 and 1,000. Now, a lower than normal score on a blood test can be caused by many conditions besides age, including testicular injury, cancer, hormonal disorders, infections, HIV, liver, kidney disease, and so on. And sometimes it might even be unknown. This case is rare. Now, having low testosterone isn't the end of the world, but it does have a direct impact on your life. Some signs and symptoms may occur as a result of low testosterone. Things like changes in sexual function, reduced sexual desire, fewer erections, changes in sleep patterns, insomnia, other sleep disturbances. Physical changes are the most obvious. Reduced energy, increased body fat, man boobs, reduced muscle mass and strength, swollen tender breasts, and even body hair loss is possible. Last, a symptom that you might be able to see is emotional changes, decrease in motivation or self-confidence, depression, and forgetfulness. So you can see that there are a lot of things that go into effect when your testosterone levels are low. So it is optimal to have your testosterone levels elevated. Numerous studies over the past few decades have shown that men with balanced testosterone levels, around 400 to 600 nanograms per deciliter, were less likely to have high blood pressure, less likely to experience a heart attack, and also less likely to be obese than men whose levels were slightly below average. That's a good comforting stat to know that if your testosterone levels are normal, you're going to be a little healthier. Now, also, researchers at the Charles Drew University of Medicine and Science found that fluctuations of testosterone within the psychological normal range of that 400 to 600 had significant effects on body fat percentage. The higher the testosterone levels, the leaner the subjects were. And conversely, the lower testosterone levels, the fatter they were. Now, when researchers decreased certain subjects' testosterone from baseline average from about 600 down to 300, they dropped it, they saw a dramatic increase in fat mass, 36%. That's a high percentage of increase in fat mass. Not only are balanced levels important for general health, testosterone does play a huge role in the development of muscle mass and strength. Now, if you care about strength and mass, like a lot of guys out there, optimal levels of this hormone are necessary to create and preserve bone density, muscle mass, and your strength. Without enough testosterone, bones can become weak, muscles can become fatigued, kind of saggy. Now, so this hormone also has been shown to increase energy during your workouts and also help improve your endurance. So finally, testosterone assists in brain activity, learning, memory skills. Now if you're an athlete, that's important because you want to make sure that you're memorizing plays, you're knowing your position and things like that. So you can see the benefit of having optimal testosterone. It's recommended that all men ages 35 and older regularly get blood tests for their known testosterone levels. Now once you get your blood test, the doctor might give you some suggestions, but just know that the higher the testosterone, the better you're going to be.